Hello all. Good morning, evening, or afternoon, depending on where you are. My name is Dr. Ruth Dottin. I'm a board-certified adult psychiatrist in the United States, and it's such a privilege to be able to speak with all of you in the Icons of Change community. I'm honored to be able to share this platform with my fellow changemakers and to come together from all different locations as a global community. Today, I want to talk about my journey as an advocate for equitable mental health care for all, regardless of race, gender, country of origin, language, neurotype, socioeconomic status, or any other demographic factor that leads to marginalization. I always wanted to be a doctor. It's the only aspiration I can ever remember having. But when I started medical school at the University of Maryland School of Medicine, I thought I was going to be a primary care doctor and work with medically underserved people. I always thought of my career as a calling to help those in need. And even then, I knew the importance of seeing patients in a holistic way, incorporating a bio-psychosocial spiritual approach. Psychiatry, though, never even crossed my mind. As I went through my clinical rotations, however, I kept being given all the difficult patients because my colleagues knew that I was good with these patients. Once I got to my clinical psychiatry rotation, it all clicked. These were my people. This is where I was meant to be. I then completed my psychiatry residency at the University of Maryland as well, and very much became indoctrinated into the medicalized model that has become mainstream psychiatry. I'm a National Health Service Corps scholar, meaning that I was awarded this scholarship to pay for medical school in exchange for working with the underserved in certain qualified medical centers. I spent my first couple of years as an attending at a standalone behavioral health clinic outside of Baltimore called Hope Health Systems, and then moved up to the Boston area after my husband received a job offer and to be closer to family. Since then, I've been working at Neighbor Health, which is a federally qualified health center associated with Boston Medical Center. After my first couple of years practicing with the traditional medical model, I began to realize that despite my best efforts, most of my patients were not getting better. And not only that, but I started to become concerned that in some cases, the medications we were prescribing may have been hurting more than helping. And that the systems of care that we have, both at large, but especially for our most vulnerable populations, like those who are economically struggling, immigrants, and or with a history of extensive trauma or serious mental illness, are just not set up to provide whole person-centered care or to treat root causes of illness. Since that time, I've been on a journey of discovery. I've become passionate about topics like the overlap of mental health and metabolic health, the importance of providing full informed consent when starting a psychiatric medication, safety prescribing when clinically appropriate, and providing neurodivergent affirming care. Mental health is one of the world's most urgent and yet overlooked health priorities. There are so many barriers that get in the way of patients accessing the services that they need and deserve. Whether it's stigma, economic and cultural barriers, or systemic inequality, and the global cost of untreated mental illness is so tremendous, it's difficult to begin to conceptualize. The loss of productive work years for millions of people due to their debilitating mental health symptoms, the extensive cost of caring for these individuals in a system that only reduces symptoms and expects patients to remain sick rather than to get better. And of course, the pain of hundreds of millions of people who have lost their loved ones to the adverse consequences of their mental illness. Although daunting, I do think individuals can make a difference, if not in systems, in the lives of the people that they work with. This is what I have chosen to focus on, providing whole person care that treats the mind, body, and spirit as the interconnected components that they are. I recognize that their mental and physical health issues are deeply related and that you cannot address one without the other. I respect patient autonomy in a system that has so often taken power away from them, making sure to provide full informed consent, collaborate with the patient on the best course of treatment for them, and safely deprescribe when indicated. And I seek to celebrate and honor neurodivergence and diversity of minds while addressing the concerns that each individual patient brings to me. Has it been challenging to provide this type of care in a federally qualified health center? Absolutely. Am I successful all the time? Definitely not. But sometimes whole person care looks like helping a patient fill out their disability forms, explaining how to interpret a nutrition label, or holding back tears as they share that they are terrified to return to their country of origin because of the extensive trauma that they experienced there. I'm one person, And while I know that my role in the lives of those that I work with may be significant, I also know that I and the other psychiatric prescribers who are trailblazers for providing the best quality care to the most vulnerable cannot do it alone. We need to place mental health at the center of Sustainable Development Goal number 3, good health and well-being. We need leaders to build inclusive systems, not only in how healthcare systems are implemented and delivered, but also in the way that we educate both our future medical professionals and the people that we serve, as well as our colleagues and leaders in the workplace. This message seeks to invite my fellow changemakers to see mental health not as a medical afterthought, but as a cornerstone of development. The future of psychiatry and the future of human well-being depends on how boldly we choose compassion, equity, and courage today. I want to thank the Icons of Change platform for joining me in amplifying mental health as a global priority and for the privilege of conveying this message to you all. As I end all my videos, I'm wishing you all good mental health today, and I hope to see you in the next one.